Assalamu alaikum. Second lectures, or the second part of the first lectures, the basic principle of the plastic surgery. What the element we have a wound, so that what the basic principle for the plastic surgery. What we mean by the plastic surgery? This is the plastic. Plastic previously we term from the Greek word the plastikos, means that to form or to mold what there is no limit to the skin. This is the problem every time we consider that the plastic surgery is limited to the skin. No, it's not limited to the skin. It's depend on the adnexia, underlying composition, any derangement in our structures that can be present inside or outside. So that the different area of the body sometimes required reconstructions by the plastic surgical elements. Detailed variable procedures we can be considered for the plastic surgeries and the development. They are still in development process, and the surgery for the plastic it's improved in the qualities and in the technique. There's a different technique from that simple one to more sophisticated, required a lot of facilities. So this is one of the innovative branch of surgery, and it's in continuous re-changing and re-improvement. Reconstructive ladders, we must concentrated on this subject. What we have these ladders? These ladders we have from the I want reconstructive some defect, I must starting from the first steps. Like the ladder, want to go upward to the upper stairs. The first things I must go through the first ladders and the second ladders and enter the final parts of the ladders to go to upstairs. This is the reconstructive process. Reconstructive process, the first object analyzed whenever we start to reconstruct, and must analyze what the problem, what my diagnosis, what the majority of this defect, what the way for reconstructions of this defect, so that I must go in principle scientific way assessment and starting my method for reconstruction, and starting my way to improvement, or to give my management from the simple way to the more complex sophisticated. So this reconstructive ladders must be understanding from that principally this wound like that of the diabetic foot, leave it to heal by secondary intention. Yes, because it is not required further, and we can get really long time for healing process, but it is best things we can do for him. Other way we must do what like the surgical wound, primary closures, and give a good healing process within simple primary closure of the wound, like the surgical wound, or simple tidy wound. Whenever we have a tidy wound and the clean edges, like by sharp object, the clean wound, early presentation, I can close it in primarily and give very good reconstruction. And after that, what I have a skin loss. I can cover this skin loss by the graft. Possible, there is not possible for the graft for this place, I put a flap. More complicated, more complex complex procedure like the flap, and then the regional flap, local flap, then the go to the upward to the regional flap, and the more sophisticated flap complex process is the free flap. This is the last things that required elements for highly sophisticated procedures like microsurgery, when we take some piece of the tissue with the underlying vessels and reconnected these small vessels to the site of the recipient. So we consider it's a free flap. We will discuss it laterly. Obtaining the fine line. All elements of plastic surgery or any type of surgery, we want to express the final result as there is no any now with small wound, now go minimal invasive or not surgery through normal orifice. All the time our hope at the surgical procedure to get very fine scar or even unapparent scar to give good cosmetic results. How I can get fine scar? How I can get on the process to this element of the fine scar? This is depend on the type of the skin, location in the body of this scar, like the scar on the face, different on the scar on the abdomen, different on the scar on the lower limb, that different in the upper limbs. All these elements different in the shape and the result of the scar. The tension on the closure, this is the wound under high tension, very bad scar, there is not fine line, while with the tension on the closure, so it's very fine. Direction of the wound, it is with Langerhans lines, it is with the tension collagen lines of the skins, so it's a very good element of the scar, fine, tidy, while very nice scar. While another on the opposite directions, I will cut the collagen fibers on this one, resulted in anxiety wound. Comorbid conditions, the patient and the condition of the morbidity of the patient. The technique that we used for the closure, my technique in the closure, what's the stitch material that we used, the edges, is it traumatic or not traumatic, there is necrotic tissue or not, foreign material, I irrigated the wound for the trauma or not, contamination of the wound. All these elements are important. Intrinsic factors, as later on previously I told us about the wound, is the similarly when I want to get good scar, fine scar, depend on the age of the patient, and different of the age and different of the process of the healing and the element of the cosmetic result of the wound. Like in the elderly, there is a loss of the underlying subcutaneous tissue, the collagen fibers are damaged and wrinkling skin, so that when we use, there is not really we result in the scar that prone, there is not prone, less obvious and less prone to stretching, and really whenever the scar in elderly that not appear very nice appear, and because the skin are with wrinkles, and this scar disappear with this normal wrinkling of aging process. Whenever type of the skin, this is also depend, like oily skin, pigmented skin give unsightly scars. This is unsightly scars because it is the consistency of this skin and the type of the skin this is responsible, and also the patient element of the fibroblast diathesis. This is not this is a problem of this the patient is related to the patient elements. Anatomical areas, also we have unfavorable anatomical area for the scar, that highly susceptible hypertrophic, as we went discussed the keloid and hypertrophied scars, that special area like in the shoulder and over the sternum, so it's the result in hypertrophied and also keloid scar, so must avoid wound in such a place. Also the element of the nutritional state of this patient and the wound, we must understand whenever we have a wound and we want good wound for healing and good wound for the cosmetic reasons, we must have our patient good nutritional supply, protein, there is no protein depletions, and there is good supply with vitamin A and also good supply with vitamin C, because the deficiency has affected the like in the scurvy, they affected the healing process and collagen synthesis. Also the zinc is required for the epithelialization and fibroblast proliferation. Iron and copper also very important for the collagen metabolism, so that there is many trace elements are important for the healing process. Also the last things, the comorbidity like a patient with anemia can be retarding the wound healing and delay the wound healing. Feature of the good scars, all the time we hope that get a good scar for the patient. There is a feature of it, there is a fine line scar, there is absent of the color irregularities, like not hyperpigmented, no hyperpigmentation, absent of pigmentation irregularities, and no contractures or distortion. All these are features of the good scar and the good surgical procedures. We will go later on, we will go what we when I have a problem in the skin and when I have a lesion in the skin, what element of surgical excision for these problems, so that there's a lot of procedures, a few numbers of them that come for the skin, like dealing on the face of the patient or extremities of the patient. Is the simple way is the elliptical excisions. Elliptical means that we do ellipse around the like that on the face around the lesions, but must we go through where longitudinally with the Langerhans lines of the skin, and then must be understand every place where is the tension of the skin line and how it can be deal with that ellipse and where's the longitudinal axis of this ellipse. While the lesions like in the located at the adjacent to the free margin, how I can deal, this is excision by the wedge excision of this lesion, and V-shape excision like on the upper eyelid or in the elements of the ear. We can be wedge excision and reapproximation of the tissue and get rid of from the other what lesions in some elements of the what require circular excision, no ellipse, and required free margin like a tumor of the skins, and I can cover or recontinuity corrected by the skin graft or flap. Multiple excisions, some lesions I cannot excise at the same at the single session, so I have multiple excision, like one of the very large congenital nevi in a special place. I want it is benign lesion, not a malignant. I can excise 1/3 of it and reapproximation of the tissue, allow for the healing, allow for tissue stretching, and after a period I will re-excise another 1/3 and another 1/3 within 2-3 sessions until I get rid of from these lesions. After I excise these lesions, whatever there is a place, whatever the maneuver, how I can close the skin. What the maneuver for the closure, any skin, any traumatic skin, whatever the type of the skin, I can close by the many maneuver or many technique for suturing of the skin. Depend on the place of the wound, depend on the cosmetic, depend on the potential contamination of this wound, depend on the risk of the infection. So the simple way and commonly used for the for that cover the wound like in the abdomen, in the extremities, by simple interrupted. I go through one side of the wound and through full thickness and go to the other side, and then I do not outside in one side wound, and this is the element of simple interrupted stitches. While other way is the vertical interrupted mattress. Vertical interrupted mattress, what I retain through the edges of the wound, and then I do my knots. Where this required, especially in elderly. Whenever I tell you that in elderly the skin is lax, loss elasticity, approximation of the tissue. Why I do suturing? What the purpose from the suturing? We must understand ourselves, ask ourselves why we do suturing. We do suturing, why? To approximation of the tissue, one edge to edge, and avoid overlap one over the another. And like I put the dermis near the dermis near epidermis, and hypodermis near the hypodermis, to get the process of the healing process. So that by simple interrupted, I get this alignment good, the epidermis near epidermis, but not the dermis with the epidermis. I cannot get, this is the overlap. So the matrix is fixed the regions. The region that fixed the dermis in its place and the epidermis in its place, so that we can be used. But it's some little bit leaving more scar, leaving more stitch lines, and scar of the marker of the stitch lines. So it is, but it's more helpful in the lax skin and difficult to approximation. Another, we have a transverse matrix, not like the vertical matrix. Other, we can be used like approximation for subcuticular. We can be used subcuticular only, and passing of the thread between the dermis and the epidermis in the subcuticular regions. All sometimes have buried some element of the wound outside and then another element in the subcuticular regions, and we can suture and do the knot in one side. Half buried or sometimes continuous whole elements of the suturing material, I pass it continuously through the wound. All the previously I tell you that all are interrupted, where sometimes we use continuous. Whenever requirement short time of closure, I can do continuous. Other elements of that not mentioned there can be used of adhesive material. Biocyanoacrylate, it is adhesive material, can be used like a glue for the skin, can be used, or some element of titanium clips, skin clips, clipping, or some we used also reapproximation of tissue with the adhesive tape. There is different type and different material used to skin closures.